Hello and welcome to my channel Zen Spine again. Today we are going to talk about coccydynia. So coccyx in simple language refers to the triangular little tiny tailbone at the end of the spine on which we sit. Coccydynia comes from the word coccyx and dynia. If you look at the word coccyx, that comes from the Greek word for cuckoo because of the shape of the coccyx is like shape of the bird's beak, which is pointed downwards, and dynia means pain. So coccydynia means pain in the coccyx. Now what are the causes of coccydynia? One of the commonest cause is it is more common in females than in males, and it can happen after childbirth or labor because of the excessive movement of coccyx that can happen during the passage of baby during the childbirth. The other cause can be trauma, as if someone falls on the buttocks, then it can injure the coccyx bone and can lead to pain in the coccyx. Other rare causes can be infection of the coccyx and growth or mass or tumor of the coccyx. The other cause is idiopathic, where we don't know what exactly is the reason for pain in the coccyx. So these are largely the causes why someone has pain in the coccygeal region. Let's talk about the symptoms of coccydynia. The most common symptom is pain at the tip of the tailbone, right where the spine ends, where someone sits. At the bottom of the tailbone is the region where it pains. It pains especially when someone sits on a harder surface or gets up from a harder surface. There also is some tenderness as someone presses or touches that particular part. It is inflamed and tender to touch. When the patient leans backwards, the pain is more compared to when the patient leans forwards, because when they lean forward, the area is not loaded with weight and hence the pain is relieved during forward position. Now what are the treatment options available for coccydynia? So the first and foremost part of treatment is that we advise patient to sit on cushions. These cushions are devised so that there is a gap in the area where coccyx is present when we sit down. So these cushions come in various sizes and shapes. They are rounded or they can be square shaped with a little cut at one of the ends so that the coccygeal area is not loaded. So this is something that the patient has to regularly carry with them. They can keep one at the office, one in the car and one at home. So regularly when they sit down, we advise them to carry these cushions so that the coccygeal area is not loaded, and that can help reduce the pain and inflammation. Along with that, we also advise patient to take some anti-inflammatory medications. We also advise patients to take hot water bath. So we advise patient to sit in hot water for a few minutes and do that few times a day to help with the inflammation. There also is some form of exercises for the ligaments and for the pelvic floor muscles that attach around that area. So working on pelvic floor muscles like Kegel exercises can help reduce the pain from coccydynia. If the pain does not reduce with medications and physiotherapy, we might advise the patient to go ahead with an injection in the coccygeal region with or without manipulation of the coccyx. So the injection usually is a mixture of local anesthetic and steroid, where we numb that area around the coccyx to ease the inflammation. Or there are also experimental studies where platelet-rich plasma or PRP is injected around this region, which can also help in reducing the inflammation and pain around this area. Manipulation of the coccyx is attempted to manipulate the coccyx and put it in the right position, and that can also help to some extent to reduce the pain. If all these options are exhausted and if the patient is still in pain, irrespective of all of these options, then the last option is surgery. In surgical options, an incision is made at the tip of the coccyx and that particular coccygeal bone is removed. If you still have any doubts or queries, please do write those in the comment section below and I'll try to answer them my best. Thank you so much. If you found this video to be valuable, then please don't forget to like and subscribe the channel. Thank you.